So lockdowns would be an absolutely last resort. What we're trying to do at the moment, Neil, is to transition this virus from pandemic to endemic through a massive vaccination program. We know the vaccines have saved over 112,000 lives, 24 million infections. We're about to embark on a massive booster campaign and, of course, a flu vaccination program, because I am concerned about flu. We haven't had much flu circulating anywhere in the world. And in a bad year, we could lose up to 25,000 people to flu. The non-pharmaceutical interventions, the lockdowns, were our only tool. That is no longer true. That we have the vaccines, we have the test and trace system, we have the surveillance, the variant surveillance system, we have the public health advice, which people followed of all ages, really, really diligently, which has allowed us to take step forward, to reopen our economy. And the booster campaign with flu will help basically protect the most vulnerable as we transition, I hope, this virus. And I can come back on your program and say to you, after winter's over, hand on heart, we are one of the leading major economies of the world to demonstrate how you transition the virus from pandemic to endemic and then deal with it on an annual basis through the inoculation, the vaccination programs. Both the JCVI, who in their guidance said, look, it is marginally more beneficial to be vaccinated, the 12 to 15, healthy 12 to 15-year-olds. It's well worth reminding your audience that we've been vaccinating 12 to 15-year-olds who are more vulnerable as per the JCVI advice. The JCVI advice also said that we should consult the 4 chief medical officers, and they have unanimously come back. This is not just Chris Whitty. This is all 4 chief medical officers of England, Scotland, Wales, and Northern Ireland to give us the advice that we should make the vaccine available to 12 to 15-year-olds. So the consent process, the school-age immunization service are really, really well equipped to do this. They've been doing it for years for children's vaccination in schools. So children will have a leaflet that they can share with their parents, and of course will have a consent form that will go to them either electronically or in some schools physically to their parents, and the parents will then read all the information, have to give consent if the child is to be vaccinated. On the very rare occasions where there is a difference of opinion between the parent and the 12 to 15-year-old, where the parent, for example, doesn't want to give consent, but the 12 to 15-year-old wants to have the vaccine, then the first step is the clinician of the school immunization service will bring the parent and the 12 to 15-year-old, the child, together to see whether they can reach consent. If that is not possible, then if the child is deemed to be competent, and this has been around since the 80s for all vaccination programs, for example, in schools, if the child is deemed to be competent, the Gillick competence, as it's referred to, then the child can have the vaccine. But these are very rare occasions, and it is very important to remember that the school age immunization service is incredibly well equipped to deal with this. Clinicians are very well versed in delivering vaccinations to 12 to 15-year-olds in schools.